let me call upon Dr. Sandip Kelkar sir and Dr. Grivita Raikar to chair the session. Dr. Sandip Kelkar sir is our past president of TAP and senior pediatrician and neonatologist practicing in Thane. Dr. Grivita Raikar is a pediatrician and neonatologist at Kaushalya and Cure Hospital in Thane and also the treasurer of TAP currently. I request them to please invite our next speaker.
Thank you, Diana. May I request Dr. Samir Dalwai to please come on stage for our next session. Dr. Samir Dalwai is a consultant developmental pediatrician, President Mumbai IP branch in 2016, member Citizens Alliance Against Malnutrition, member Maha State Commission for Protection of Child Rights. Over to you, sir.
Just
Thank you.
Opening comments. We are going into a different trajectory now, into mental health, and as we know that WHO has come out with a slogan in 21st century, no health without mental health. And no conference should be without a session on mental health. And that's what we are following as TAPians. And this will be a session which will be really important. And we have a very eminent speaker, Dr. Samir Dalwai. And it will be a really interesting session, I'm sure about it. So over to you, Samir.
Thank you so much, my dear friend, Dr. Sandip, for your kind words, Dr. Grivita. So it's always a pleasure and honor to be here at Thane, and my respects to my dear friend Dr. Ram Gopal, Dr. Vivek, Dr. Ramesh, Dr. Grivita, Dr. Bhavesh, Dr. Sandeep Kadamji, Dr. Suhas Kulkarni, Dr. Parmanand, my colleague in the EB, and of course Dr. Abhay and Dr. Ashwini Marathe, and Sandeep and all the seniors here, Dr. Suhas Prabhu. I believe Dr. Amdekar has already left. So thank you so much for this kind invitation. Always a pleasure to be here. And a tough act to follow after Dr. Sridhar Ganpati's highly evolutionary talk. And I was just mesmerized with all your talk about kissing tonsils, large tongue, beating heart, nasal passage, and so on and so forth. So we realized that if any of the audience is feeling sleepy, it's not actually the presenter, but it's your nasal passage. So you need to do more about it. And I must say your talk on sleep was highly awakening for many of us. So thank you so much. And in fact, you brought up such lovely, important points that it's even made the talk on COVID look very ordinary. So thank you so much. It takes off my stress. Well, I'm going to present some of the cases that we see in our clinic. 3-year-old child is brought to you for complaints of mild fever and coryza. I'm sure this is a commonest thing that you see. But mother says he has become more hyperactive, aggressive, keeps clinging to the mother, doesn't even allow her to go to the washroom. He has started thumb sucking and is irritable, does not like to have visitors at home, doesn't like to go to anybody's house, only calms down when there is a screen. So it takes you 3 minutes to figure out that the cold and cough is nothing very important, but you don't know what to do about this. Another child, 9-year-old girl child, comes to you with enuresis, and the neuro examination, all the other relevant history is negative and normal. Now when you ask the mother, she also says she does not want to sit for online classes without her mother, and the mother moves out of the room during the classes. She starts crying, will pause the video till she comes back, has become again more clingy, wants to sleep with the lights on, does not want to let go of the mother, in spite of the fact that earlier she had started sleeping alone. So this is secondary enuresis coming up now in the absence of any biological cause. 15-year-old child, you go across the ages, he comes to your clinic with poor appetite and some weight loss. Parents get complaints from school that he keeps the video off when addressed directly during the classes by the teacher. He seems totally disinterested, distracted. Academic performance is declining. He was kind of an average student earlier, but he's not doing very well. So these are the children that we are going to see, or these are the histories that we see in our office practice in the last few weeks or months. And I believe this is going to go on because children have not been affected seriously, fortunately, by the virus, but there has been a huge impact on their mental health and confidence, and it has affected them very badly. And this has impacted what we see in our office practice. Dr. Suhas Prabhu sir is here. He is the chairman of the Maharashtra COVID Pediatric Task Force. And one of the main things we have been trying to see is how do we also minimize the impact of the psychosocial forces on the children's mind. And we are trying to look at that. But this is more relevant because in our office practice, as we gear up to face this impending challenge, it is up to the IAPNs and the pediatricians to be the mainstay by guiding parents and protecting children from these issues. And this is possible if in our office practice, we look at a few things like what are the risk factors, we just understand the red flags. We look at a little bit of parent education and guidance, and we do a SWOT analysis of our own practice and what are the changes we need in our practice. And at the same time, parallelly, we need to look at ourselves in this post-pandemic or ongoing pandemic era as to do we pay enough time and attention to how this has affected us as human beings, as doctors, as a father, as a mother, as a daughter, as a parent in your own house, as a friend to your own people. How has it affected all of us? The risk factors, though I will be talking largely about children, affect all of us. And that's the real thing about COVID that all of us must understand. It's not only affecting patients. It has affected all of us because physical health, mental health, environment is intertwined for all of us. If it is school for the child, it is our clinical practice and office practice for all of us. And the stress and the disruption has had a huge impact on us. This was a paper, Dr. Bakul Parekh in his presidential address, a presidential page, in fact, brought it up in Indian Pediatrics in December 2020, which we jointly wrote about the impact of COVID on children's mental health. And these studies are coming out now. I'm not going to talk about the impact on children because that's not part of today's talk. I'm sure you've had sessions on that earlier. But how does it affect our practice? It affects our practice because we need to understand that this prolonged isolation, departure from the routine, this sense of foreboding and gloom and pyres being seen and bodies floating down the river, all this with the loss of lives, loss of livelihoods, people have lost jobs. It is leading to an acute panic, anxiety, depression in all of us, including the children who are now coming to our clinics and in our office practice. And we cannot deal with any parent without understanding that the parent is also equally stressed, equally anxious. There are so many who are already going through post-traumatic stress disorder. So we might find that the parent is unduly disrespectful or not courteous, but it's not the case. We have no idea what they are going through in their personal life. There is another impact on children which is largely due to just the screen time because now education has come online. Parents tell doctor क्या बात कर रहे हैं आप टीवी कैसा मोबाइल कैसे बंद करेंगे पूरा स्कूल तो उस पे चल रहा है. But Indian Academy of Pediatrics in their parental guidelines, and I'm sure you've seen this, has brought out the effects like headache, dry eyes, weight gain, distractibility, gadget addiction, academic underperformance, and online cyberbullying, etc. If you multiply it by what Sridhar spoke about, the other issues on sleep, and if the child has some predisposing issues, we can understand the problem that we are in. And just to summarize it, addressing this global crisis, it was earlier than to COVID, it was estimated that the rates of depression were about 8.5 and for anxiety were 12%. Just in the last 2 years, this has doubled almost to a 24% proportion of population having depression and 20% of children having anxiety. This has just doubled in the last 2.5 years. So in our office practice, what are the red flags to look out for? They are different for all the 3 age groups. So I have divided them below 5, say 6 to 12, and then the adolescent age group. This is something I just want you to take a mental note of, or just make a kind of a to-do or a checklist in your clinic. Attention-seeking and regressive behaviors. A child who was not clingy is now becoming clingy, who is not leaving the mother even to go to the washroom, like I said. Thumb-sucking, bed-wetting has restarted. They are not able to play or engage in the activities that they were usually there, but the fussy and demanding part is what will really confuse you. These children have become much more fussier. Now that irritates the parent because she also has to manage the house, she has to do her online work, she has to look after the other things. And this leads to a more negative reaction from the parent, which leads to the older children now showing an oppositional defined kind of a behavior. Of course, in this segment between 6 to 11 years, you have a higher addiction of gadgets. Everybody is on gadgets. Parents are told, parents say कि doctor वो school का चालू है, लेकिन वो कोई और window पे जाता है. And when I just come behind him, suddenly I see him switching the windows. So this has become very common, and these children are showing mood swings at a much earlier age. We used to see this in adolescents. So you'll be confused now whether I'm talking about adolescents or I'm talking about the middle agers. And this is the impact of COVID. In adolescents, whatever was already, we all of us know that this is a terrible phase for all of us to go through and the parents to go through, but this has just multiplied many times more, leading to a very high need for all of us in our clinic to look for words or actions talking about self-harm or violence against self or others. So though we look at the diet, though we look at the sleep, though we look at the academics, though we are looking out for substance abuse, the incidence of suicidal ideation has gone up much more. So this is what we need to be aware about. And across all the ages, the 4 things that I picked up which I'd like to share for you is look out for children who are more isolated. Death in the family, mother now being not at home. One of the parents being a doctor is a high risk, because he's going to be out of the house all the time, and so many doctors' children have suffered because they just haven't seen their parents. Media has become all pervasive, but what we are missing, and again I am glad Sridhar brought it out, is sleep has just gone for a toss because of this blue light and all the arousal, and sleeping late and poor physical exercise has completely put sleep into a big problem. And a lot of parental stress is now reflecting of the children. So these are the things that we must be aware about to look out for. And like we mentioned, you cannot overemphasize looking out for suicidal ideation. And again, being isolated, so this word comes out, being more on the media, being cut off from your friends, not enjoying meeting friends or doing all that tafri that we used to say earlier that all of us as adolescents used to enjoy. And I feel worse for this group of children, because adolescents, if I'm sure Sandeep will tell us and all of us know, the best friends that we ever made in our life, even before going to medical college, was this adolescent age group, because that is where you really connect and identify with people like you. This entire generation is going to miss that. Look at sleep pattern changes. I don't want to go into details because you cannot do better than what Sridhar said. But make a point to ask the parent, does the child wake up more as compared to before? Does he have difficulty falling asleep? If he wakes up, does he have difficulty falling back to sleep? And so on and so forth. I am fortunate to be looking after special children even more, and we have seen 2 kinds of impacts on special children. One is worsening of behavioral symptoms. Children with autism have shown some regression in communication skills because they are missing their intervention, they are missing their routines that they are so used to. Children with ADHD are getting more aggressive, as we have seen. Depression and anxiety is common amongst the parents of children in this segment. And worsening of compulsions. But I'd like to mention another interesting thing I'm sure all of you have seen. We are seeing many more children with autism coming to the clinic. So people think that COVID has worsened autism. Do you all think so? The irony is that autism is being picked up more because parents are at home to see the child. Otherwise, they would have been in their office, both the mother and the father. The child would have been in daycare watching television or in the school, and only been picked up at 4 or 5 years by the school teacher for unruly behavior in the classroom. And this is why I believe we are seeing more number of children, because parents are there at home actually to pick up that something is going wrong with my child. And it's also important to understand the parent you deal with, the patient in the clinic is brought by the parent. They themselves are feeling such a tough time because so many people have lost their jobs. I mean, just being at home with your spouse for 24/7 is not a situation many people in urban areas were used to. And it has exposed so many fault lines within the couples themselves. And children are now seeing it. Earlier, even the lady had a little escape from the in-laws because office mein jaane ka, aane ka, kahin ek cup chai peene ke shanti se pee sakte. Now it's all that in the house. So all this has caused a lot of stress on the parents, sleep deprivation, because they have to take care of all of this, put the child to sleep, then sleep herself. So we need to be extra courteous about this. But frankly, the impact is not only on children, it's on all of us as adults. And that's what I'm going to focus on today. And especially healthcare providers, because look at the expectation on us. We are expected to not only work from home where needed, work in the clinic, work under COVID situation, but be available all the time. And if we were people who were sponges for negativity, now we've become super sponges and super magnets, I think, because everybody's negativity is just coming on to us. And it's not going to get better, because all post-pandemic predictions say that, as Dr. Suhas will tell you, the infections may get better, fortunately, or hopefully after Omicron gets over. But the mental health crisis is only going to get worse because of the emerging recession, about parents, and so many things have changed. The fact that the schools will reopen and children will go to school. Last year we were saying school chalu karo, bachcho ko school jana hai. Abhi school chalu kiya hai, bacche bol rahe school nahi jana hai, mast chal raha hai ghar pe. मम्मी डैडी है, खाना खिलाने के लिए सेवा हो रही है, टीवी देखने मिल रहा है. अरे स्कूल में मोबाइल मिलेगा कि नहीं तो नहीं जाने का हमको. पेरेंट्स आर ऑन द अदर ट्रैक, वैक्सीन मिलेगा तब भेजेंगे, बच्चे बोल रहे हैं स्कूल में मोबाइल मिलेगा तो जाएंगे. सो ऑल दीज थिंग्स आर गोइंग ऑन, एंड एवरी डार्क क्लाउड फॉर्चुनेटली हैज़ अ सिल्वर लाइनिंग. I have seen that families who are well adjusted and organized, even before the pandemic, everything was smooth, streamlined, parents were focusing on the child as well as their work, and things were going on well, have in fact come out stronger. And you will see this, some of your parents telling you, doc, we are actually happy, we are at home, we get more time to spend with each other as spouses and with our children, and we are all doing fine. But there are those who did not have a well-organized kind of a family structure earlier, and they've come out, they've had a problem. But the families who saw the storm coming and got their act together right in the beginning, and we'll talk about how, actually have managed to benefit or get better in the pandemic. What have we learned as pediatricians? As my brother Sandip said, the most important thing is, just like we've been forced into using digital currency, and physical currency has gone out of currency, so to speak, all of us have had to pay attention to mental health. And that's getting increasingly more. I don't see much talk about the antivirals or the vaccines. I see as much talk about what is to be done about this mental trauma that all of us are going through. And as, again, I'm sure Sandeep will have spoken to us about EQ, understanding the situation that the child in front of us, and more importantly, his parents or her parents are going through is very important. At the same time, what our partner at home, our children at home, our parents at home are going through is very important. So simple things we have all learned to look for these red flags that I showed. We all learned quick methods of assessment, quick ideas or tips for parental guidance, and judicious referral. We have all learned to work together. So I'm just going to show you a few quick tips what all of us in our office practice can do. And all of these are easy to remember, the 6 M's. Younger children, make sure that you ask for their milestones, whether they are missing their milestones, whether they're getting delayed milestones or deviant milestones, like instead of normal speech, they're developing echolalia, or instead of normal behavior, they're developing patterned behavior by copying what they're seeing on the screen. Look at mood swings, especially in older children, but now, like we said, even in the middle group children between 6 to 12. Look at or ask for history of how much media and what kind of media are they using. Look at whether they're able to interact, do they have an opportunity to interact with others. Question about their meals and their daily routine, because meals, and I'll share this article with you, just came out in yesterday's Marathi Sakal, that eating is not just a physical nutritious activity, it's a social emotional activity, especially in a country like India. जेवण आपण एक पद्धतीप्रमाणे आपण करत असतो. It's not about proteins and calories only. So whether there is a fixed schedule and whether children and people, parents are sitting across talking while having meals. And finally, do ask about academic performance deterioration, but don't prioritize the patients that I am asking about the marks, because the last thing we need to worry about is marks. And that's another thing that Swaz Bhai and we have been working upon, making parents aware that when the child goes back to school, do not focus on catch up academics. अरे 2 साल से बच्चे का पढ़ाई नहीं होगा, अभी 2 महीने में कंप्लीट करने का, अभी अप्रैल में एग्जाम आएगा, अभी अप्रैल में एग्जाम आएगा, 2 साल का पढ़ाई कंप्लीट करना है. फॉर गॉड सेक, बिलीव मी, यू विल डू अ ग्रेट सर्विस टू सोसाइटी इफ यू टेल द पेरेंट्स कि डोंट डू दिस. It's not humanly possible for anybody to catch up in 2 months what happened in 2 years, and it's not going to impact his life. If he was not going to be Einstein, even now he will not be Einstein, because he was never going to be one. Don't chase Einsteins. And especially the children who had some problem, they are going to have this worst if you put them in this gold chase. So make a point to tell parents that. Simply try. None of us have a great deal of time in our office practice, but somebody just sent me this picture, so I have put it up. Is the child doing okay? Is the child that's on the right side thriving? You can use a emotional thermometer, as somebody has said, whether he's thriving, whether he's striving to thrive, or whether he's just surviving and struggling, or is actually in a very bad shape. So in your mind, all of us, I mean, we take maybe 2 minutes to even come to a conclusion whether the child has malaria or typhoid. So we are so good at clinical analysis. Just this is to sensitize you that you can look at it in this kind of a algorithm or an approach. For younger children, I mean, just putting up these charts, because we all know children are not able to verbalize. Mummy बोलेगी, अभी डॉक्टर के पास जाएगा ना, सब चीज़ बोल के दिखाना. That's the surest way to make sure that the child won't open his mouth. Because मम्मी बोला है ना, तो अभी नहीं बोलूँगा. And we are also, अरे बेटा क्या तकलीफ है? कुछ तकलीफ नहीं है, I'm unhappy. लेकिन I don't know कि unhappy होना तकलीफ है या नहीं आपके हिसाब से. So he doesn't know what to say. So a simple thing like, okay, what do you feel like out of all these pictures? What do you feel like today? How is today? Don't even ask him, how are you feeling like? How is today looking to you? He will point to one of these pictures. On the right side, again, somebody sent me, and this is available on Amazon, Moodometer. Just ask the child to point the arrow at what today feels like. And that's something very easy to do, and you will be able to monitor over a period of time. Is the child, okay, he's not feeling good today, but 10 days later, has he got out of that bad phase, or he's still on the same side of the clock? So watching for that pattern is very important. Simple advice in office practice, the simplest things that you can do is, I'll tell the parent to start with having a schedule. I will share this secret with you. In my practice in the last 1.5 years, the biggest thing that has helped my practice with special children, and it's so simple, it's a secret, but the moment you hear it, it's yours. Just get all the parents to make a schedule for themselves and their child. Because then everything falls into place gradually, and the stress that the mother has, father has, and the children has goes out. There is a predictability to the environment. The child knows what's coming next. So there is an anticipation कि अभी 10 बजे खेलने नहीं जाने मिलेगा सुबह, मगर 4 बजे definitely जाने मिलेगा. It helps the child calm down. It decreases the temper tantrums that actually arise. Because the child will throw a fuse sometime, but the mother is unprepared for it. She will worsen it. But if you have a schedule, set the rules, follow them consistently, then it helps the family. The other problem is 24 hours news channels running on. That grandfather at home, poor guy, has nothing else to do. So he's constantly watching, आज कितने infection हो गया, आज rate बढ़ गया, down हो गया. So they're either watching Sensex on one side, whether it's rising or going down, and they are watching COVID numbers on the other, whether it's increasing or decreasing. Limit gadget use, as we spoke. Participate in the children's activities. Very often you have to tell parents this, that you stop your laptop to your work, join the child, do what they are doing, play with them, and help them in their studies, but do not stress for performance. This is the last thing we need to look at now, is performance. IIP has come out with this parent guideline, so I will not talk much about it, but I will emphasize on this: do not overreact thing. Most of the times parents come to you, you will see, यार ये तो, you will listen, भाई बच्चा ये नहीं कर रहा है, ये नहीं हो रहा है, घर में ये problem, you will feel like, boss. This reminds me of Nirupama Roy, always crying in Hindi films, always unhappy. वो उसका बेटा एक विजय है और एक रवि है, mother is always unhappy, always crying. So this is actually worsening what the child is undergoing at home. Imagine being at home all the time with being complained to, with being nagged. And most of the times a parent, the child will come and sit calmly in your clinic for 5 minutes. अरे इधर शांत है बेटा डॉक्टर, घर पे ऐसा नहीं रहता है. अरे इधर शांत बैठा है क्योंकि इधर शांति है. आपके घर में शांति नहीं देते आप, इसलिए घर में ऐसा बैठता है. So you just need to get some of these message across. This picture is there in the IIP guidelines as well, and this applies to all of us also who are online most of the time. The posture, the position, and you can just share this, the IIP parental guidelines, you can just share the link with your patients who come to you. Also, there is a role now to look at us prescribing these drugs which we are not comfortable with, because residency में किसने सिखाया नहीं. So simple things like for anxiety, ADHD, aggression, sleep issues, a small dose of fluoxetine or methylphenidate or risperidone or melatonin for sleep helps. If you are not comfortable, refer it to somebody, but come back, the parent will come back to you. Do encourage if needed to start with this. There is another issue that is very common, and I get calls from parents saying that, doctor, my niece has just lost her father and the mother is in depression, or the mother also was COVID positive, she is also in isolation, or how do we now tell the parent, the child, because father is dead and he was fine and the father had come back 3 weeks from the ship because the grandparents were unwell. The grandparents have got well, but that father got COVID and died, and the mother is under isolation. Do we tell this child or do we not tell this child? So there are some articles. There's a portal called news18.com. So I've been writing some articles on them. There's a picture there, because parents need to be told that don't hide things from the child. If you hide things, it's just like adoption. If you hide and if the child finds out, not only does the child have to face the trauma of having lost a parent, he now distrusts you. He's lost both. So you need to be upfront. Don't break it like, okay, I'm so sorry you've lost your father. Don't say that. But break it in the way that you can. Every culture of ours tells us, whatever it is, you can start off with that, whatever is culturally appropriate. But get the child to understand that things have changed. Allow the child to participate in the, नहीं हमने उसको देखने ही नहीं दिया. देखने नहीं दिया तो उसे कैसे पता चलेगा क्या हुआ? You need to be there holding that child's hand. He will hold your hand tightly, but he will see it. She will face it. They will go through it. They want to participate in it. What they need is support after that. So allow the child to express grief the way he or she chooses. Doctor, वो ऐसा हो गया ना घर पे, the child lost his mother, लेकिन वो बच्चा रोया नहीं है. आप जरा उसको रोने के लिए बताओ. This is ridiculous, but this is very common. Because in our culture, if people in the house are not crying, We pay outsiders to come and cry. I'm sure you know this happens in some parts of. So it somehow feels कि रोएगा तो बहुत मतलब दर्द निकल जाएगा. रोने से गम नहीं निकलता भाई. रोने से गम नहीं निकलता. Rona is one expression. Somebody may express that way, somebody may not express that way. But you need to understand that अरे नहीं रोया, it doesn't mean उसको कुछ फर्क नहीं पड़ा डॉक्टर, वो रोया भी नहीं बच्चा. कैसा कठोर? It's not कठोर. He may not be able to process the pain. And what you have to do is just be there, don't be judgmental or ritualistic, but speak with the child. How are you feeling? Every morning wakes up at breakfast, join him. How are you doing today? What is your plan? What are you planning to do today? Are you joining online school? Are you going to talk to your friend? Would you like to go out in the evening? From this, the child will start speaking, and then jo gham hai, that will come out on its own. Some indications for referral, all of these situations, if they persist beyond the simple tips that you give them in the office practice, and they're still not getting better, like I said, the moodometer still stays on the red zone, then you need to refer the child to a specialist. Whom do you refer to? I am told, and Sandeep, you will also bear with this, there are at least 30-40 portals that have come up which offer emotional aid suddenly to whoever wants anything. Previously, we had only one Love Guru on FM. Now we have hundreds of advisors coming online. We don't get psychologists in our clinic today because they are being employed by these overnight apps or situations which have come up, which have a great deal of funding because it's a business venture. So the idea in a business venture is put in for 3 years and then reap for the next 30 years. They are being paid so much just to be online. People connect. It's like customer care. अरे मेरे गाड़ी का एक्सल टूट गया है. Somebody will tell you. Tomorrow he'll call up, अभी आज carburetor खराब है. Somebody else is telling you. That's what's happening with mental health. You may call and they'll connect you to the person who's listening. He'll listen. And today's consultation is over. Next time when you call, तेव्हा जो customer careला available असेल तो तुमचा psychologist. असं हे खरोखर चाललंय. So we need to be very clear that you refer to somebody who's recognized as an expert like Sandeep or like Dr. Ashwini Marathi or whoever else are working in this field, who will write on a piece of paper what they feel about the child. Write on that piece of paper and sign that yes, this is what Sandeep feels, this is what Ashwini feels, because then they have paid attention to it. You get referrals and you get children who are being seen for 2 years by various specialties. It's not a scrap of paper. How will they take accountability? क्या फर्क पड़ता है अच्छा हो ना नहीं हो? We get beaten up, our hospitals get burned down even when you do the right things. But on the other hand, there is a parallel quack industry where nobody writes down what's going on with the child. So even when you refer to these para-professionals, make sure that they are following up with a pediatrician or with a neurologist or a psychiatrist who's officially trained. Finally, the other part in the next 5 minutes about parents in office practice. Like I said, they are themselves more anxious, they have gone through a lot. They may not be courteous, but it doesn't mean that they are disrespectful. So deal with them with empathy because we don't know what they have gone with. They are very worried nowadays. Doctor, is your clinic COVID is appropriate? So again, Suhas Bhai has brought out those guidelines, wonderful for schools. What should school do to be COVID appropriate or safe for COVID children? I think similarly, those things can be adapted for how to adapt your clinic, and even IAP has brought out those guidelines because parents will ask, कि आपके यहाँ how often do you do the sanitization, so on and so forth. And today, most of them would want to go online even at least for small issues where they don't want to come to the clinic. So there has been a paradigm shift from offline to online. And today we have even the DIAP and the smart clinics, and Dr. Bakul Parekh, we cannot forget to mention him, has brought out this tremendous revolution where all of this on the IAP platform assuring full quality can be provided. We all face challenges, and the biggest challenge is we don't like we want to be face to face, the parents want to be face to face, difficult to establish rapport. In fields like proper pediatrics where you need to examine the child, look at the skin, parents will send WhatsApp photos, what is the problem with the skin? It's not only the skin, like whatever Sridhar explained now, how can you ever see it online? So these issues about assessment and diagnosis are there. We are mainly technically challenged, but there are advantages as well. Because the child and the family can be all together with us online, where the child feels a comfortable, safe and a comprehensive approach at home. And we have gone online for our special services also, and in fact we have found that it has benefited us because helping the child do well at home is a real inclusion, not just getting him to do some occupational therapy activity in my clinic. And even here we conducted a study in the COVID thing where we studied the parents' reaction to stress. And then we were giving them some counseling about how to handle the child in the class, at home. Let me tell you, most of them were similar tips to what I shared with you already. And actually over 4 weeks and 6 weeks of coaching and counseling the parents, we have shown a significant decrease in their stress levels. And I'm talking about children with developmental concerns. So I'm sure it will be much easier in other children. Finally, the topic was lessons in office practice that COVID has taught us. What is the office? What is our clinic? Clinic is a place where you work. You work. I have highlighted you, not work, because it's all about you. And it's also a place where you see patients. I have not highlighted patients. I have highlighted you, us, because this is what we miss out. We definitely look out for the patients. We come here morning to evening, Sunday, pura hafta kaam karte hain. There must be something abnormal about us. And I don't know how our families tolerate us. Full week we are busy in the clinic from morning to night, and Sundays we want to go and attend conferences. Banquet attend kiya samjha? Conference भी attend कर रहे हैं, खाने खाने का time हो गया, आप बैठे. Why? Knowledge. For what? Are you going to write a PhD? No, knowledge for your child, for the patient who comes to your clinic tomorrow. This is the dedication we have. But who's looking out for you? Who's telling you what to do? Who's telling you, hey, look, when was the last time you actually sat with your spouse and had a great chat? When was the last time you went over to your friend's house for a cup of tea? When was the last time you went to play tennis or any other activity? But we need to keep that in mind. So our office is a place where we need to also look, call over your friends sometime for a cup of tea after clinic hours. Sit there, listen to some music. And again, I always keep remembering Anand Shandilia. In his clinic, वो एक मस्त बोस का एक समीर एक मस्त बोस का स्पीकर लाया. पेशेंट आएगा थोड़ा वॉल्यूम कम करने का, बाद में वॉल्यूम बढ़ाने का. पेशेंट बाहर गया तो वापस से he used to keep listening to this kind of nice, calming music all the time. And these are the things we must remember. So office is not just a place for patients and work. It is your office, your home, so to speak. Going ahead now, we have to look at hybrid models. It won't be only physical. You will have to have a component of online practice and an online presence. So the office today is both online and physical. Our practices have changed. There's an indication from all over the world that patients will prefer online activities sometime or the other. So you have to have a good presentation. Just in the physical clinic, you have a good reception, preferably a good receptionist also. And you have a good waiting room, you have a nice colors, and you put up those children animation and cartoons on the wall. Even your online presence has to be dignified, has to be pleasurable. Get some digital designer or something that when you appear, your window opens, it looks nice. There can be a small, not the entire Doordarshan ka tune aata tha, utni lambi tune ki zarurat nahi, but there can be a small ting, or like Netflix opens up with that typical ting, because it gives you a uniqueness and an identity and makes the parent feel, oh, this guy is focused on what he's doing. Look at that visual screen behind you. There is an option to select the background screen, right? Make sure you put up your clinic's name, or you put up a nice picture, or whatever represents you behind you. This is an opportunity. You can't do this in your physical clinic, but you can do it here. You can change it after every patient. You can change your digital office after every patient. Physical में change नहीं कर सकता इतना. Digital presence is very important. Are you sufficiently seen on the web? Do you have a good website? Are you on WhatsApp? Is your account friendly enough? Are you on Instagram? Are you on Facebook? Now there are so many of our younger colleagues, the below 30 guys, all of us have friends. They'll record, grivita also does that, they record videos and put it out. And it's a big help, because the patients today will look up what you do before they come to you. So they've seen this doctor talking about, okay, how do I put my infant to sleep? If there is a diaper rash, what would you do at home? Simple things like this, people are watching on YouTube, on Facebook. So be sure that you are there and you put it out. You can write or a blog on your own page, on your own website, and so on and so forth. And of course, digital safety for yourself, for the patients, as well as for the records. Challenges are many. Technology, none of us are very happy. The problem is availability. Now, Dr. Ramesh, we are available 24 hours. Because the patient has had one consultation on WhatsApp. He thinks as long as your WhatsApp चालू है, I can contact. वो शोले में था ना, बसंती जब तक तेरे पाँव चलेंगे इसकी सांसें चलेंगी, तो जब तक तुम्हारा WhatsApp पे ऑनलाइन आप है हम कंसल्ट कर सकते हैं, ऐसा वाला हिसाब हो गया है. And that has sapped our physical and mental energy both. There is no break, because work and professional life has become even more pervasive now. This is a true pervasive disorder. And hence we have to ask ourselves this following 4 questions. This is for all of you. We don't have time now, unfortunately, it's not a workshop. But you can just note it down and sit today evening somewhere with a cup of coffee or tea and answer this question for yourself. How do you think the pandemic has changed you and your family. How do you think the pandemic has affected your practice? You have to answer how it has. What do you like to do now? Now, on the contrary now, because so many people shut down their afternoon or evening practices, they say, abhi hum one time we practice karte. We go at morning 9 o'clock, and I used to come back COVID ke pehle 4 o'clock. COVID ke pehle I used to go back again at 6. Now I don't go. Now from 10 to 5 I do it, then I am free. There are doctors who have enrolled for online Hindustani classical lessons. There are doctors who are learning German or Urdu. There are doctors who are learning to play a musical instrument. There are doctors who are playing online Ludo in the evening. Very good. So it has changed what you like. The time you spend with your children now is different. You may be watching a series on Netflix. What do you like to do now? Be aware of it. Finally, what are your strengths, weaknesses, challenges and opportunities? And that's what we call a SWOT analysis. What are the strengths today? Do your parents like you more, patients like you more online or offline? Is your online presence good enough, or is that a weakness? What are the challenges? Technology, get it solved, get hold of some advisor. And opportunities now, you don't have to see children only in Thane or Waghli state. You can see children in Timbuktu. You can see children from Australia. You can see children from any part of the world. The whole world is now become your referral ground. And that's very important. All these things, especially jo dil pe beeti hai, are often subtle and difficult to recognize, understand, explain. We can't even tell our friends sometimes or act on. But ourself is most important. Actively need to seek support for ourselves. If we feel stressed, overwhelmed or too sad at times, there is no shame in looking out for oneself. A healthy and happy self is essential for a healthy and happy profession. So I salute all of you, your dedication to the profession, no doubt about it. But don't ignore yourself. And if you find that things are not going away in your own life, in your own house, with some simple tips, Sandip has done such amazing work on EQ, you can talk to him or look up his website. If these things don't help you, don't hesitate to go and seek somebody else. It's better to consult somebody else than to be not there at all. And there's no problem, because it's always better to be safe than sorry. And like all bad things, the pandemic will end too. असं वाटत नाही सुहास भाई, पण होणार कधी ना कधी, वो सुबह कभी तो आएगी. For some there will be an irreparable loss. Some of us have lost our dear and near ones. वो नहीं आने वाले वापस. But for most, things will slowly start getting better for all of us. And hence, we are the role models for our children. If we reflect stress, it's causing stress in the patients, parents we see. If they are stressed, it reflects in the children. So as a pediatrician, we have to take care of ourselves first, and then we take care of the child. Things are not very easy. I've told you maybe one plan. But plan A may fail, but there are 25 more alphabets in the English language. Try plan B, plan C, whatever. Ridley Scott has a film company, it's called Plan B. Ridley Scott is one of the very famous director-producers of Hollywood. Plan B, companies is now Plan B. Because Plan A name fail hoto chapla. So learning to be optimistic is what is going to help us get through this difficult time. And this is from the most brilliant psychologists in the world, or psychology textbook, Calvin and Hobbes. Don't read any other textbooks or books for psychology. Read Calvin and Hobbes. Because if you can find even one person you really like, you are lucky. A child imagines a tiger, imaginary tiger is a friend, because jo real hai, they never have time for him. Parents don't have time, friends don't have time. और अगर फुर्सत है भी तो समझने के लिए किसी को capacity नहीं है. So even if you find one person you really like, you are lucky. So the idea would be that can you be that one person for the child, but who is there for you? Because if you come next time and are talking to an imaginary tiger while walking around, then we'll all be worried. So thank you very much for a very opportunity to speak to all of you. Thank you.
Thank you, Samir Bhai, for that excellent talk. I think you have touched upon most of the points, and you have given this overview. It was a Herculean task actually to finish half an hour, whole mental health post-COVID times, and you have done wonderful work. It's an absolute privilege. Always it's a privilege to listen to you. And he's covered most of the points which office practice pediatrician has to do. Is I think we should be looking at, we look generally at hemodynamics, but now we have to look at hemodynamics also, isn't it? And we should be having that feelings and emotions should be one of the vital parameters we should be looking at. And that's what he, Samir Bhai, very well mentioned about. And he went through all the red flags which pediatricians need to understand. And then, of course, what to do, how to take care of parental education and communication with the parents, which is so much important. And last but not the least, about the self-care, the self-compassion. And as doctors, as pediatricians, we are so much stressed out, and burnout is so much in us, and it's going to reflect in parents and children ultimately if we don't take care of ourselves. Thank you so much for such a wonderful key points which we have given about the mental health and what office practice pediatrician should do. I have got one question, because I think it should be there in all of the parents who are there, doctors as well as parents here, that now the offline mode is going on and children are going to go to schools, and that's going to be a real challenge. It's a change for them. So how do a pediatrician in the office practice, talk to parents about the change and how they are going to tackle with that change and help the child to, face that change of offline schooling? Because this reopening of school is just coming up now.
No, that's a brilliant question actually. And the real answer is that the lockdown was easier for children. The unlock is going to be more difficult. Because initially everybody thought 3 weeks ki holiday diya humko. So the children were happy that we've got a holiday and just before the exam, so they were happy in March 2020. But now they are so used to being at home with that, what I mentioned, that ecosystem being set up at home, and they have broken so much from social interaction that they no longer feel the need to step out of their comfort zone. So as Kulkarni and I am very great friends, but कभी ना कभी थोड़ा दोनों को adjust करना पड़ता है ना. ये adjust करने का will power चला गया है, ज़रूरत नहीं है. नहीं जमता है, तुम्हारा देखो मैं मेरा दे. And this is going to be there as a post-COVID effect for a long time for this generation. What's very important for parents is to tell them start small and don't force. Don't make rigid rules. Be flexible. Approach each day as it comes. Start first by making a schedule now for the new school. So from Monday, if school is starting next week, this week onwards make a timetable. If the school is going to start at 8 and your child has to leave home at 7:30, from today start waking him up at 6:30. Because currently he is waking up at 9:30. So this whole week also, if he continues to wake up at 9:30, next week on the first day of school, if you try to wake him up at 6:30, there will be what we call school refusal. And then there's some psychiatrist or somebody will look at it from a school refusal point of view. It's not school refusal, it's sleep. So and today, first day, why I'm saying a week before? Because he won't wake up today at 6:30. So 9:30 ka at least today, he'll wake up at 8:30. 2 days later, 7:30. And then 1 or 2 days before actually school starts, 6:30. On the first day, the parent may take the child, he may go up to the door of the school and fall asleep in the car. ठीक है, come back. Next day, he may start screaming and shouting, मैं नहीं जाऊँगा. No problem, come back. Do it for 3-4 days. Let the child realize कि ऐसा कोई अंदर tiger नहीं है. But if you try to force, because you have to go to office after that immediately, then the child will get more and more oppositional and defiant. So set up the schedule right now, work on it slowly, don't push the child, don't make the child anxious. If the child is not willing to go out, call your uncle and aunt home, let the child meet the uncle and aunt at home, then send him to that uncle and aunt's house, then send him to other neighbor's house, then send him downstairs to the playground to play, let him interact with the children he knows first, then with school children will be worth going. Try and make rules in the house such that the child has to gradually get adjusted to it, otherwise he will not listen to the school teacher. Who are you? घर पे मैं वीडियो ऑफ करता था, इधर बटन किधर इसको ऑफ करने का? That kind of thing might happen, and she is not going to shut up like that in the school. So I think be patient with each child, and this is going to be a very important part of your practice. Tell parents, come and follow for a follow-up 8 days later, 10 days later, whatever advice I have given you today, see whether it is working. Encourage them to follow up with you. The COVID has given infectious disease a big boom, but otherwise infections are going down. Even the government is giving all the vaccines now. Pediatricians will have to wonder what is the new part we are going to add to our practice. Everybody is not as intelligent and brilliant as Dr. Mukesh to do immunology, at least I am not. But we will have to look at wellness, we will have to look at mental health, if not morbid conditions, at least mental health as part of our practice. So I would encourage all of you to start calling your patients back, talk to you. You may initially consult them for free, but over a period of time, you will even set up a revenue model. That's what I think. Thank you, sir.
I have one question. In children who are existingly on therapy, the special kids, I mean, COVID has posed a real financial burden to the families. Are there any NGOs who could fund their daily therapies or something like that? I mean, are there any financial aids which could be given to such kids? Because the loss of therapy is basically because of financial crisis at home.
Yes, you're right. There are two aspects to it, the financial and the physical traveling of the centers being shut down. So there are organizations which may be giving sponsorships, provided we write down clearly what the child's condition is and what is the benefit from that therapy that he's getting. And there are many organizations, religious trusts, so on and so forth, philanthropists who do give that. The other interesting aspect to your question, Grivita, is that the amount of therapies that I used to give to children before COVID and after COVID has dropped by 50%. But what we have increased is coaching the parent. In fact, I have an online program called Enable Parent Coaching Program, which is only targeting the parent. The child doesn't even come in front of the screen. And we are doing this very successfully for even children with autism. The advantage being parents are at home today. And what we have to give the child intervention is to exist in his own house first. Inclusion in the house. How to behave normally in the house. Then how to behave in the mama's house, kaka's house, auntie's house, then how to behave in the neighbors, then how to behave with known children, and then in the school. That is true inclusion. Just giving therapies, in fact, sometimes tends to make the children even more stereotypical. I believe now giving too much of speech intervention makes the child more echolalia. So in fact, COVID has been the kind of speed breaker which made us think, are we doing the right thing? Because initially we tried to give therapies online the same way as we are doing in the center. It doesn't work. And then we have to rethink this entire approach of dealing with children with special needs. So the point is, innovation has to be there. All of us have to change. All of us have to look at new ways of delivery online to help children better. That's what I'd like to say.
Thank you so much.
Thank you.
I think because of time constraint, we'll take the questions over lunch. Samir,
thank you so much.
Will be available. I hope.
Yes,
for
yes,
the
yes.
lunch.
I'm
Yeah.
there. Thank you so much.
Thank you so much again.
Thank you.
I invite Diana.
Thank you so much, sir. Please take your chairs. Please don't leave immediately. We'll be doing one of the lucky draws now before lunch. So please wait for some time. I request Dr. Sandip Kelkar, sir, and Dr. Grivita to felicitate Dr. Samir Dalwai, sir. Dr. Vaishnavi to please felicitate Dr. Sandip Kelkar, sir. Thank you, sir, for chairing the session. Dr. Vaishnavi to felicitate Dr. Grivita.